Gentlemen, let me start with something direct, because this is a topic many men never talk about yet. It quietly worries them more than almost anything else. Have you ever reached climax, felt the pleasure, but realized there was little or no fluid released? Maybe it happened once and surprised you. Maybe it has become a pattern you do not understand. Or maybe you have kept it to yourself because you were afraid of what it might mean. If that sounds familiar, I want you to hear this clearly. You are not losing your masculinity. You are not broken. And you are not alone. In fact, the very fact that you are here listening, trying to understand what your body is telling you, already puts you in a rare category of men your age. Men who pay attention. Men who take control instead of ignoring what is happening. Men who want clarity instead of silence. I am Dr. Olivia Cater, a urologist with more than 15 years of experience helping men across the United States protect their vitality, their confidence, and their intimate health. And today we are going to talk about something many men fear, but very few actually understand. Dry ejaculation. The moment when the pleasure arrives, but the fluid does not. For many men, this moment creates a quiet shock. They feel the satisfaction but see nothing happen. And instantly, their mind goes to the worst place. Am I losing function? Is something wrong with my prostate? Is this the beginning of decline? But here is the truth almost no one explains. Climax and ejaculation may happen together, but they are two completely different systems. One is neurological, one is mechanical. And when fluid is missing, it is almost always the mechanical part that has changed, not your ability to feel pleasure, not your identity, not your masculinity. But I understand why this worries men. For most of your life, climax and fluid were one single event. When that changes, it feels unsettling. It feels unfamiliar. It feels like something important has disappeared. And that is exactly why this conversation matters. Because when you finally understand what causes this, what it means, and what can be done about it, the fear dissolves, the confusion fades, and you regain something even more important than fluid. You regain confidence. Before we go deeper, I want to know something from you. You are here because you care about your health, and you are paying attention to your body in a way most men never do. Tell me in the comments where you are watching from. Your response helps me understand who I am reaching, and it reminds other men that they are not alone in this. Now take a breath and stay with me. Because in the next section, we are going to break down exactly how ejaculation normally works in a way that finally makes sense. And once you see how the system is designed, the causes of dry ejaculation become much clearer. To understand why ejaculation might change, you first need to understand how it works when everything is functioning smoothly. And once you see the structure behind this process, the causes of dry climax become far less mysterious and far less frightening. Inside your body, 3 major systems work together with remarkable precision. Your testicles produce sperm, your seminal vesicles create most of the nourishing fluid, and your prostate adds the protective component that allows everything to move safely through the urethra. This mixture doesn't simply appear. It is collected, prepared, and positioned inside the urethra, waiting for the final moment. When climax begins, your brain triggers a neurological wave. Specific muscles contract rhythmically, pushing the fluid outward. It is a coordinated effort between nerves, glands, and muscles. And for most men, their entire lives, this system works so seamlessly, they never even think about it. But here is the part most men never realize. Climax and ejaculation are not the same thing. They feel like one event, but they are 2 separate mechanisms. Climax is the neurological sensation of pleasure. Ejaculation is the mechanical release of fluid. Your brain can still fire the pleasure signal exactly as it always has, even if something in the mechanical pathway has changed. That is why many men tell me they feel the full sensation of orgasm, but see little or no fluid. They assume that because the release is missing, something in the pleasure circuit must be broken too. But that is not how the system works. The pleasure center is intact. The signal arrives. You feel the moment. What changes is simply the pathway the fluid normally takes. Men often describe this moment to me with worry in their eyes. They say it feels like an empty orgasm, like something is missing. But it is not their ability to climax that has changed. It is how the fluid moves, or in some cases where it ends up. And once you understand the different pathways fluid can take, you begin to see why this process can shift even when everything else feels normal. One of the most important things I want you to take from this section is this. The presence or absence of fluid does not define your manhood. It does not measure your strength, your desire, your potency, or your ability to enjoy intimacy. It is simply one part of a complex process that can change for reasons we can identify and reasons we can address. And now that you understand how the system is supposed to work, we can move into the part most men truly need clarity on. Because the moment fluid disappears, there is one cause that accounts for the majority of cases. It is surprisingly common. It is mechanical, not emotional. And once you understand how it happens, the fear around dry ejaculation begins to fade quickly. We are going to dive into that next. And once you hear it, you will finally understand why this condition often surprises men, but does not mean their function is disappearing. Now that you understand how ejaculation normally works, it is time to talk about the most common reason men experience climax without fluid. And once you hear this, you may feel a wave of relief, because it is far more common and far more mechanical than most men imagine. The leading cause of dry ejaculation is something called retrograde ejaculation. It sounds complicated, but the mechanism is simple. Imagine a small valve sitting at the entrance of your bladder. During climax, this valve is supposed to close tightly, creating a barrier that directs semen outward. When everything functions as designed, the fluid goes forward and out. But if that valve does not close fully, the fluid takes the easier path backward into the bladder. You still feel the full pleasure. You still experience the neurological climax. But the physical release is missing because the fluid went in the wrong direction. Many men describe it as a normal orgasm with an empty ending. For some men, the only clue is what they see afterward. Their urine may appear cloudier because the semen has mixed with it. That simple sign often confirms what is happening long before any test is done. And here is something important I want you to hear. This does not mean you have lost potency, strength, or desire. It simply means the mechanical gate did not close properly at the right moment. This change can happen for several reasons. Prostate surgery or bladder surgery can alter the nerve pathways that control that valve. Some medications, including those used for blood pressure or certain antidepressants, can relax the muscle that should be holding the valve shut. Long-standing diabetes or neurological conditions can weaken the communication between the brain and the pelvic nerves. One of my patients once came to me devastated after a successful prostate procedure. He thought he had lost his sexual function entirely because his climax no longer produced fluid. But when we explained that his pleasure erection ability and intimacy were still intact and that the issue was simply a mechanical redirection, the fear disappeared from his face almost instantly. That single explanation restored a sense of control he thought he had lost forever. Diagnosis is simple. A urine sample collected right after climax can reveal whether semen traveled into the bladder instead of out. And once men understand what is happening, they often feel a tremendous sense of relief. Retrograde ejaculation is not dangerous. It does not harm the bladder. It does not affect your ability to enjoy intimacy. The main impact is on fertility, not on performance or satisfaction. But retrograde ejaculation is not the only cause. There is another category of issues that can create dry ejaculation even when the valve is functioning normally. It involves something most men have never heard about: blockages in the ducts that carry semen forward. And once we talk about those, you will understand why some men have dry climax, even though every other part of their system is working as intended. We will explore that next, and it may reveal something you have unknowingly experienced for years. Retrograde ejaculation is the most common cause of climax without fluid, but it is not the only one. There is another category that surprises many men because it has nothing to do with hormones or desire. It has to do with the pathway the semen uses to leave the body. And when that pathway becomes blocked, reduced, or narrowed, the result can look exactly like a dry climax, even though everything else feels normal. Think of the ducts that carry semen as small roads. The seminal vesicles produce most of the fluid. The prostate adds its contribution. And these fluids must travel through narrow channels before reaching the urethra. If one of these channels becomes blocked even partially, the fluid simply cannot reach its destination. The sensation of climax happens because the nerves still fire. But the release does not occur because the route is obstructed. These blockages can form for several different reasons. Past infections, like untreated prostatitis, can leave behind scar tissue. Some men develop small stones, similar to kidney stones, that form inside the seminal vesicles or ejaculatory ducts. Others may have cysts or anatomical changes that narrow or close the passage. And because these ducts are so small, even a tiny obstruction can drastically reduce or completely stop the flow of semen. Symptoms can be subtle. Some men tell me they felt a little pressure or discomfort during climax. Others say they noticed their fluid becoming thicker or decreasing gradually over the years, until one day it almost disappeared. Most men assume the change is simply aging, but in many cases it is structural. Diagnosis usually involves imaging, often a transrectal ultrasound. It sounds intimidating, but the procedure is quick and provides a clear picture of what is happening inside the seminal vesicles and ducts. The good news is that many of these blockages can be corrected. If an infection caused the problem, treatment can reduce inflammation and restore function. If a stone or cyst is present, minimally invasive procedures can remove the obstruction. Once the duct is open again, fluid often returns to normal. But blockages are only part of the story. There is another system that plays a major role in ejaculation 1 that quietly changes as men get older, and many do not realize how deeply it affects their experience. It influences desire, fluid production, orgasm, intensity, and even the emotional connection to intimacy. And when this system shifts, dry ejaculation can be just one of many signs. That system is your hormonal foundation, especially testosterone. And understanding how hormones contribute to this condition can change the way you see your body, your aging process, and your next steps. We are going to break that down next, and this part may explain more than you expect. Now that we have talked about the mechanical causes, we need to look at another major system that plays a powerful role in the presence or absence of semen, your hormones. For many men, over 60 changes in ejaculation are not caused by surgery or blockages. They are rooted in something deeper, something that gradually shifts over time without making any noise. And that system is testosterone. Testosterone is not just about desire or energy. It supports the prostate, the seminal vesicles, the nerves involved in climax, and even the muscles that contract during ejaculation. When levels fall too low, the entire network becomes less coordinated. The result can be weaker fluid production, reduced volume, or even the complete absence of visible semen. Many men also notice less intense orgasms, softer erections, decreased energy, and changes in mood. These symptoms often appear slowly, so men assume they are simply aging. But in reality, many are experiencing hormonal decline that is treatable. A simple blood test can confirm whether testosterone has dropped beyond the healthy range. And when it is restored safely under medical supervision, many men report improvements not just in fluid production, but in clarity, mood strength, and the depth of their intimate experiences. But testosterone is not the only concern. Dry ejaculation can sometimes signal something more serious. Certain cancers, such as prostate or bladder cancer, can interfere with the ducts that carry semen. Neurological conditions like Parkinson's, multiple sclerosis, or nerve damage from long-standing diabetes can disrupt the communication between the brain and the pelvis. These conditions are less common, but they are the reason dry ejaculation should never be ignored when it appears suddenly, is accompanied by pain, blood fever, or any loss of sensation. If any of those symptoms appear, immediate medical evaluation is essential. Acting quickly protects far more than sexual function. It can protect your long-term health and independence. And this brings me to something emotional that many men never say out loud. When ejaculation changes, the impact is not just physical. For many men, it affects how they see themselves. It can create anxiety, embarrassment, or a sense of distance from their partner. Some begin avoiding intimacy altogether, not because they do not want it, but because they fear being judged or misunderstood. If this sounds familiar, hear me clearly. Dry ejaculation does not define your manhood. It does not erase your capacity for pleasure, connection, or intimacy. Your brain still experiences climax. Your nerves still function. Your ability to enjoy intimacy is still fully alive. The absence of fluid does not take away your identity as a man. What transforms this situation is understanding it, talking about it, and seeking help when something feels off. Clarity restores confidence. A diagnosis restores direction. And acting early restores control. To close, here are the steps I want you to remember. Do not ignore sudden changes in ejaculation. Keep chronic conditions like diabetes and hypertension under control. Maintain a healthy lifestyle with movement, good nutrition, and solid sleep. Communicate openly with your partner. And when something feels different, seek professional guidance. You deserve answers, not uncertainty. I have seen countless men regain confidence once they learned what was happening in their body. You are not alone in this. In fact, the fact that you are still here listening puts you in a rare group of men who take their health seriously, who take action, and who refuse to let confusion define their relationship with their body. Before you go, tell me in the comments where you are watching from and whether this conversation helped you understand something you have been wondering about. Your answer may help another man who is silently feeling the same worry. And now a quick reminder. This video is for educational purposes only. It does not replace medical advice. Every man's body is unique. If you experience sudden changes, pain, blood fever, or loss of sensation, please consult your healthcare provider. Your well-being deserves personalized care.